Welcome to Everyday Nursing Knowledge Lectures, and today we will learn about metabolic acidosis. What is metabolic acidosis? It's a condition in which acid builds up in our body or blood. How do you know a substance or a liquid is acid or base? By knowing the pH of the substance. So the pH measures the hydrogen ion concentration. So the higher the hydrogen ion concentration, the more acidic, and the pH level drops. The pH ranges from 0 to 14. And 7 is neutral. So anything below 7 can be acidic and anything above 7 can be basic. So the less the hydrogen ion concentration, the pH level increases or the substance can be basic. Now, coming to blood pH level, the normal blood pH level is anywhere from 7.35 to 7.45. There are two organs that helps to maintain the balance of the pH. They are lungs, that is respiratory, and kidneys, which is metabolic. So acidosis and alkalosis can be due to a respiratory issue or metabolic, which can be due to kidney problems or other issues. So how does lungs and kidneys helps to maintain the blood pH? Now coming to lungs, the carbon dioxide which is inhaled as well as the carbon dioxide formed by the byproduct of metabolism, it combines with water to form carbonic acid. This carbonic acid is a weak acid and it splits into bicarbonate and hydrogen ions. So when the lung hyperventilate, that means when the respiratory rate increases and depth increases, it blows off, it removes the carbon dioxide. And when the carbon dioxide level drops, the hydrogen ion concentration also drops. So when the hydrogen ion concentration drops, it increases the pH. Same like when the lungs hypoventilate. That means the rate and the depth of the respiration decreases, it can retain the carbon dioxide. So when the carbon dioxide level increases in the body, more hydrogen ion is produced. So more hydrogen ion means the blood pH decreases, becomes more acidic. Now how kidneys helps to maintain the blood pH? Kidneys can excrete both bicarbonate and hydrogen ions and helps to maintain the blood pH. But remember, the respiratory system always acts fast, whereas renal system, it is a slow and steady system. It helps days to maintain the balance of the pH. Now, what are the causes of the metabolic acidosis? Remember the word acids. A stands for accumulation of lactate, which is acidic in nature, which you will see in hypoxia or decreased oxygen level. Oxygen level decreases, anaerobic metabolism takes place. As a result, lactic acid is formed, which is acidic in nature, and that leads to metabolic acidosis. You will also see lactic acidosis in sepsis. C stands for chronic diarrhea. In chronic diarrhea, there is loss of bicarbonate, which is basic in nature. That leads to metabolic acidosis. I stands for impaired renal function. In impaired renal function, kidneys cannot excrete hydrogen ions. So hydrogen ion level increases. That leads to metabolic acidosis. Now D stands for diabetic ketoacidosis or uncontrolled diabetes. In DK or uncontrolled diabetes, fat is metabolized for energy. As a result, ketones are formed, which is acidic in nature, that leads to metabolic acidosis. S stands for salicylate toxicity, which has salicylic acid. It's acidic in nature, and salicylate toxicity you will see in poisoning with aspirin. Ethylene glycol, which is a content in antifreeze or methanol. Now what happens when a body is in metabolic acidosis? If you look at the pH, it's acidotic, so the pH level drops. The normal pH is 7.35 to 7.45. So when the blood pH drops, it will be less than 7.35. The bicarbonate level, which is a base, the base drops. It is 22 to 26. The level will be less than 22. Now our body has a compensatory mechanism which helps to bring back the pH to normal by blowing the carbon dioxide out. So you will see an increase in the rate and the depth of respiration. What happens when the rate and depth of respiration increases? Blows off, removes carbon dioxide. When carbon dioxide is removed, remember the hydrogen ion level concentration decreases and helps to bring up the blood pH. Now what are the treatment for metabolic acidosis? The treatment, always treat the underlying cause, IV fluids to hydrate the patient, IV sodium bicarbonate, which is basic in nature, and to neutralize the acid, IV insulin if it is secondary to diabetic ketoacidosis, and removes toxic substances if it is secondary to poisoning. So today we learned about metabolic acidosis, and thanks for watching my video.